Hello, welcome to my student support system. In today's class, we will discuss very important topic nursing process. This lecture is in English and if you want to study in Hindi, just click on I button and you will get link of Hindi lecture or you can directly visit to my channel my student support system. What is nursing process? The nursing process is nursing practice in action. The nursing process is the framework for providing professional quality nursing care. It directs nursing activities for the health promotion, health protection, and disease prevention, and is used by nurses in every practice setting and specialty. What is history of nursing process? Lydia Hall first described nursing process in 1955 and in 1967 Ura and Walls published the first comprehensive book on nursing process, in which they described four steps of nursing process: assessment, planning, intervention, and evaluation. Gaby and Levin in 1974 described the nursing process as a five-step system by adding diagnosis in it. What is the definition of nursing process? Nursing process is defined as an orderly, systematic way of identifying the client's problems, making plans to solve them, initiating the actions, or assisting others to implement this plan and evaluating the extent to which the plan was effective in resolving the problems identified. Characteristics of nursing process. First characteristic is that providing framework. The nursing process is a framework that enables a nurse to give nursing care to the individual, family, and society. Systematic and orderly. Each nursing activity is a part of an ordered sequence of activities. The nursing process directs each step of nursing care in sequential and ordered manner. Cyclic and dynamic. Yes, nursing process is dynamic. Each step of nursing process flows on to the next step. And in some nursing situations, all the steps occur simultaneously. And in some cases, in the cyclic form. How? We will discuss later. That after evaluation, sometimes we need again to reassess. Goal directed and client oriented. The nursing process offers a means for nurses and patients to work together to identify the specific outcome related to health promotion, disease and illness prevention, health restoration, and coping with altered functioning during the disease process. Interpersonal. Yes, nursing process is interpersonal because there is an amount of interaction that might be necessary between nurses, patients of similar illness, and medical team. It might involve group therapy and family counseling. Universally acceptable and applicable. Yes, the nursing process is universally applied all over the world by the nurses in every setting. This process is universally standard and no matter what is the institution it may be, the process remains the same. It is like a common nursing language with common nursing terminology followed all over the world. Specific and scientific problem solving. Nursing process is a systematic process which are based on scientific and critical thinking. It involves scientific methods or problem solving such as problem identification, data collection, hypothesis formulation, plan of action, hypothesis testing, interpretation of results, and evaluation, resulting in conclusion or revision of the study. Now we come to the important part of this nursing process, that is the steps or phases of nursing process. Nowadays there are 5 steps in nursing process: assessment, diagnosis, outcome identification and planning, implementation, and evaluation. Now we will discuss them one by one. What is assessment? Assessment is the first step in nursing process and includes collection, verification, organization, interpretation, and documentation of data. The completeness and correctness of the information which we collect during the assessment are directly related to the accuracy of nursing process. Types of nursing assessment. Normally, we assess 4 types. We assess the client in 4 ways. What are those? These are comprehensive initial assessment, the focused assessment, emergency assessment, and time-lapsed assessment. Again, we will discuss them one by one. What is initial assessment? The initial assessment is performed shortly after the client is admitted to the hospital. The purpose of this assessment is to establish a complete database for the problem identification and care planning. The nurses collects data concerning all aspects of the patient's health, establishing priorities for ongoing focused assessment and creating a reference for future comparison. What is focused assessment? The focused assessment In the focused assessment, the nurse gathers data about a specific problem that has already been identified. A focused assessment may be done during the initial assessment if the patient's health problem surfaces, but it is routinely the part of ongoing data collection or ongoing assessment. Another purpose of the focused assessment is to identify new or overlooked problems. Emergency assessment. An emergency assessment may or may not be the part of routine nursing process because it is done only during emergency situation. All 3 types of assessment are done routinely, but emergency assessment is done only in the case of crisis. An emergency assessment is done to identify life-threatening problems at the time of crisis. For example, choking in the dining hall, it needs emergency assessment. A bleeding patient brought to the emergency with a stab wound, this also needs emergency assessment. And an unresponsive patient in the rehabilitative unit or sudden collapse of a patient in the ward, these situations need emergency assessment. Time-lapse assessment. This is very important. The time-lapse assessment is scheduled to compare the client's current status to the baseline data obtained earlier. The time-lapsed assessment is done to reassess the health status of client and to make necessary revision in the plan of care. Data collection. The first step of assessment includes data collection because without data, without basic information, we can't assess. Data are collected from a variety of sources. However, the client should be considered as primary source of data. As much information as possible should be gathered from the client. Secondary source includes family members, other healthcare providers, and medical record. Two types of information are collected through the assessment component. These are subjective data and objective data. Subjective data are gathered by interacting with the client and includes client feelings, perception and concerns about the present condition. Objective data are observable and measurable and are obtained through physical examination and diagnostic tests. Now, second step is data validation. Validation is the act of confirming or verifying. The purpose of validating is to keep data as free from error or bias and misinterpretation as possible. Validation is an important part of assessment because invalid information can lead to inappropriate nursing care. After validation of data, these all data are recorded and analyzed. Second step or second phase of nursing process is nursing diagnosis. The second step is formulation of a list of nursing diagnoses. A nursing diagnosis is different from medical diagnosis. Normally, for one client, there is only one medical diagnosis, but nursing diagnosis may be one or many. So we make a list of nursing diagnosis, and the nursing diagnosis basically informs about the problems the client is facing. A nursing diagnosis focus on individual, family, and community response to the actual or potential health problems. So two types of nursing diagnosis we write, actual and potential. An actual nursing diagnosis indicates the problem exists and is composed of a diagnostic label, related factors, and sign and symptoms. An example of actual diagnosis is impaired skin integrity. This is the label. What is related? It is related to the prolonged pressure on bony prominence. So in this way, we make nursing diagnosis. Okay, this is actual diagnosis. And what is potential? Potential means that may occur in the future because predisposing factors are present. A risk nursing diagnosis, we call it a risk nursing diagnosis. It indicates that the problem does not yet exist, but risk factors are present. A nursing diagnosis is composed of the diagnostic label preceded by the phrase risk for, with the specific risk factors listed. An example of risk diagnosis is that risk for impaired skin integrity related to inability to turn self from side to side in the bed. Okay, so side to side turning is not possible for the client at present situation. It may lead to skin impairment. So this is the possible or risk for diagnosis. So the method of writing it, that risk for the problem and then related to the condition or factor. Okay, for example, here it is written that risk for impaired skin integrity related to inability to change the position in the bed. Now, outcome identification and planning. So here we decide that what should be the outcome after implementing the nursing care, means our goals. Planning is a framework on which scientific nursing practice is based. The four critical elements in planning include establishing priorities, setting goals and developing expected outcome, planning nursing interventions, and finally documenting or writing the nursing care plan. Establishing priority. When an individual client has more than one diagnosis, the nurse and the client need to establish the priority to identify the which nursing diagnosis will be addressed initially in the plan of care. One of the most common methods of setting priority is consideration of Maslow's rule of needs, which requires that the life-threatening nursing diagnosis be given more urgency than non-life-threatening diagnosis. Setting goals and developing expected outcome. After formulating nursing diagnosis and establishing priority, the nurse sets goal and identifies and establishes the expected outcome for each nursing diagnosis. The goal should be established to meet the immediate as well as long-term prevention and rehabilitation needs of the client. Now, planning nursing intervention. A nursing intervention is an action performed by the nurse that help client to achieve the result or expected outcome or goals. These actions are based on scientific principles, knowledge from the nursing, behavioral, physical sciences. It is important to identify as many as nursing interventions or plans as possible so that if one proves to be unsuitable, then others are readily available. Now, documenting or writing the nursing care plan. It is very important. After careful planning, all the details are written in a format known as nursing care plan. There are a lot of formats available used for writing nursing care plans in different institutions, in different countries. Different types of nursing care plans are found, but the basic information are the same. Here we are going to discuss a 5-column nursing care plan which can be used in every setting. Here it is. You will write nursing care plan here in the heading and then name of the patient, registration number, date, medical diagnosis, ward number, unit number, bed number, and healthcare provider or the nurse who is making this plan or going to implement. In first column, we will write heading assessment. Second column is for nursing diagnosis. Third column is for planning nursing intervention. Fourth column is implementation. And fifth column is evaluation. So before starting implementation, we make this care plan and complete the 3 columns. Okay. So first, all the subjectives and objective data we write in the assessment column. And based on these assessment, we make the list of nursing diagnosis. And we write here 1, 2, 3. Example you can see here, ineffective airway clearance related to bronchospasm. Now nursing intervention or expected outcome we write here. For one diagnosis we make 2, 3 or as much as possible nursing plans. We write here interventions, that is provide more liquid and warm water to drink. One intervention. Second, teach and encourage for effective coughing and breathing exercises. Oxygen inhalation as ordered. So we have written these 3 interventions and we will implement it. So for each diagnosis we write this and our writing of nursing care plan is now okay. Then we go to implement and after implementing we write in this column. So what is the implementation? During the implementation step of nursing process, the nursing actions which are planned in the previous step are carried out. The purpose of implementation is to assist the patient in achieving valued health outcomes, promote health, prevent disease and illness, restore health and facilitate coping with altered function. The plan of care is best implemented when the patient who are able and willing to participate have maximum opportunity to provide self-care. Family members and other support people as well as healthcare professionals, health team may also be involved in successfully implementing the plan of care. The implementation phase of nursing process requires cognitive, psychomotor, and interpersonal communication skills. Nurses perform a variety of activities that are designated to assist the client in meeting needs. Nursing implementation activities includes ongoing assessment. Because the client's condition can change rapidly or new data may become available. So ongoing assessment is necessary to validate the relevance of proposed interventions. Second is establishing priority. In the action, again we set the priorities. Priorities are based on the severity of the problem that are deemed most important by the nurse, client, family, and significant others. Allocation of resources. Whereas some interventions are complex and require the knowledge and skill of a registered nurse, others interventions are relatively simple and can be delegated to assistive personnel. Initiation of nursing intervention. Interventions can be implemented on the basis of standing orders and protocols. A standing order is a standardized intervention written, approved, and signed by prescribed practitioner and the skill learned by the nurse for a particular procedure. Nursing interventions include assisting with activities of daily living, delivering skilled therapeutic interventions, monitoring and surveillance of response to care, teaching, especially health education, discharge planning. Documenting of intervention. So, the communication concerning to implementation of interventions must be provided through written documentation. And now it should be written in the fourth column. Implemented. What you have implemented, what care you have given. That should be written in the fourth column, so that the next staff who is coming to provide care can understand what was done for the client and what is to be done next. The nurse is legally required to record all interventions and observations related to the client's response to the treatment. Now, last step is evaluation. Evaluation is the fifth step in the nursing process and involve determining whether the client's goals have been met, have been partially met, or have not been met. Even though it is the final phase of nursing process, evaluation is an ongoing part of daily nursing activities. Steps in evaluation includes establishing standards, collecting data, determining the achievement of goals, related nursing actions to the client's health status at present, judging the value of nursing interventions, reassessing the client status, and modifying the plan of care, replanning. Replanning means as a cycle it will go if needed, otherwise it is okay. Thank you student for watching this video. For watching other such videos, you can subscribe my channel, My Student Support System, like Facebook page of My Student Support System, and for making your notes, visit blogger mynursingstudents.blogspot.com. You can follow me on Twitter, Instagram, and join Facebook group Nursing Notes. Thank you. Have a nice day.